you today?
We're doing great. How are you?
What brings y'all in today?
Well, we have some concerns with Annie's speech. She seems to have a lisp, and she's very hard to understand, sometimes even to us.
How old is Annie?
She's 4 years, 8 months.
Well, I reviewed her case history, and I saw that she has a history of chronic otitis media. How frequently is she diagnosed?
Like 2 to 3 times every 6 months.
And I see that y'all are considering tubes.
Yeah, we talked to our pediatrician about it, and it's because sometimes we suspect that Annie may have a hearing loss because she doesn't respond whenever we talk to her.
Well, as y'all probably know, otitis media is caused by the inflammation of the middle ear due to fluid buildup, and the tubes can relieve that. But if Annie can't hear well, she may be experiencing a language development delay. So we should probably do a hearing screening to make sure that she can hear and doesn't have any conductive hearing loss.
Okay.
When did you notice that she first started to lisp?
When she was about 3 or so.
And your husband has grown up with a lisp, right?
Right, he still does it.
And when did he begin lisping, do you know?
Probably at around age 5.
And has he ever been evaluated or had therapy or anything like that?
No, I don't know if he's been evaluated, but I know he's never attended therapy.
Okay, and well, as y'all know, lisping is not usually genetic, so therapy can be very beneficial for Annie, if that's the case. Has she ever been hospitalized or had surgery or anything?
No surgery, no.
Does your child go to any other doctor other than her pediatrician?
She's seen an ENT. The pediatrician recommended we do that to check out the options for tubes.
And are there any other precautions we should take, like food allergies or anything like that?
She's allergic to peanuts.
Okay. Now I'm going to take Annie back in the other room for a hearing screening, and then we'll be right back out. What we're going to do is we're going to put some magic earphones in, and I need you to help me listen to the beep. So whenever you hear a beep, I want you to raise your hand. Okay, one more. Okay, good job. Now you can go back and see your mom for a little bit.
How'd you do, Annie? Good.
She did well in her hearing screening, but she did have some problems with some low beeping sounds.
So can you tell me about what you're going to do to check her speech impediment?
Well, we don't really know where lisping comes from or where it originates, but it's commonly associated with abnormalities of like the teeth or the tongue or the palate, and also a hearing loss is a main issue, which is why we really have to evaluate Annie further. Also, children who have tongue thrusts, if she ever sucked her thumb or overuse of pacifiers or bottle feeding or anything like that can also contribute to lisping. So I think next what we're going to do is have an oral mech exam to basically evaluate everything in her mouth and see if everything's normal.
Okay. And what types of tests do you do?
Pay special attention to her bite and her tongue, the mobility of her tongue. I'll probably give her a straw and she can follow the straw with her tongue. And I want to see how strong her tongue muscles are, so I'm probably going to put a spoon down and see if she can push against it. Come on, Annie, let's go play with the toys in my box. And Mom, you can come too.
Okay.
Okay, Annie, I'm going to put the straw and I'm going to move it from side to side, and I just want you to follow it with your tongue, okay? Can you touch the straw with your tongue? Okay. Okay, one last thing. I'm going to put this on your tongue and I want you to just push against it as hard as you can, okay? Okay, good job. Okay, Mom, so I'm going to give Annie a couple tests, and you can wait in the waiting room while I give them to her, but I just wanted to explain them to you first so you know what I'm doing.
Okay.
I'm going to give her, there are 3 different tests. One is the CSIM test, and I'm going to say a word out loud, and I want her to repeat the word. And this basically just tests to see how easy it is to understand her. Then I'm going to give her the GFTA test, which checks her articulation. and it has 3 parts. It checks the sounds in words, the sound in sentences, and the stimulability section. And I'm going to show her a picture and ask her to name the items on the picture. And I'm also going to ask her to imitate a sound that she has previously had problems producing.
Okay.
I also am going to ask her to examine the examinee to retell a short story based on a picture.
Okay.
Lastly, I'm going to give her the CAP test, which assesses her phonological processes or her speech errors. And that also uses pictures to elicit sounds.
Okay. Well, I'll be in the waiting room. Have fun, Annie.
Okay, Annie, I'm going to read you a list of words, and I want you to say the word after I say it, okay? Mist.
Mist.
Sift.
Sift.
Soul.
Soul.
Shade.
Shade.
House.
House.
Good job, Annie. Okay, Annie, let's go back and see Mom and tell her how great you did. Alright, Mom, we finished all the tests, and Annie did very well. So I think we're going to do one more thing. I just want her to read a story with her and have her point out some things in the storybook.
Okay.
Okay, Annie, I want you to help me read the story. The monkey likes to climb in the trees.
The monkey.
Right. What animal is this?
The zebra.
Good job. The zebra. And where does the tiger live?
The jungle.
What animal is this?
A horse.
Good job. A horse. Alright, let's go see Mom. After evaluating everything, she had slight problems with her hearing, as we said, with some of the low beeping. She does have mild CHL, conductive hearing loss, from the otitis media. And also from the oral mech exam, I did notice that she does have a slight tongue thrust, which basically means that her tongue is flattened and it thrusts towards the front of her teeth, which means that she has an interdental lisp, is what we call it. This type of lisp is usually gone about 4.5 years old, but considering her history and everything else that we saw today, and the fact that she is 4 years, 8 months, it would probably be a good idea to start some therapy. And we are probably going to concentrate on her tongue placement the most.